Welcome. Thank you for being here this evening, everybody. My name is Mia Tamburi, and I am a member of the Education and Outreach Work Group for the Cancer and the Environment Network of Southwestern Pennsylvania. I'm also the Program Director of Cancer Bridges, and tonight is the second lecture in our new speaker series. The series is a project from the network, which is composed of organizations and individuals who are concerned about environmental chemicals and how they are contributing to our region's high rates of cancer. The organizations co-sponsoring tonight's webinar are Cancer Bridges, formerly Our Clubhouse and Cancer Caring Center. At Cancer Bridges, we provide support for those impacted by cancer, including counseling, support groups, health and wellness classes, family and youth activities, and much more. Young Adult Survivors United, a community in Western Pennsylvania for young adult cancer survivors and their co-survivors. And Leukemia and Lymphoma Society. LLS focuses on blood cancers and improving the quality of life of patients and their families through research, education, policy, and advocacy. The websites for these organizations will be found in the chat. Now I would like to introduce tonight's speaker, Dr. Matthew Mihalik. Dr. Mihalik serves as Executive Director of the Breathe Project, a coalition of local residents, environmental advocates, public health professionals, and academics advocating for healthier air for the Pittsburgh region. From 2007 to 2016, he served as Program Director for Sustainable Pittsburgh, where he created Champions for Sustainability. Dr. Mihalik teaches environmental policy and community resiliency courses at Heinz College at Carnegie Mellon University. He has written multiple peer-reviewed publications in sustainable design and education, and has co-authored Ethical and Environmental Challenges to Engineering with Michael E. Gorman and Patricia Werheim. Dr. Mihalik's PhD is in systems engineering from the University of Virginia. He serves on the boards of Phipps Conservatory and Pine Richland School District. Dr. Mihalik is going to speak with us for about 30 minutes this evening, and then we will have time for questions. But feel free to put any questions in the chat if you would like further explanation about something he's talking about. Dr. Mihalik, thank you for being with us this evening.
Thank you very much for inviting me to be here, and thank you for that wonderful introduction. It's an honor to be able to give this talk tonight. And thank you very much for giving the background on the Breathe Project. We're 50 organizations working together to improve air in southwestern Pennsylvania. It takes all of us to do this because this is a long-standing problem, and it really requires all of us working together to solve it so our region can move forward. So I hope to talk a little bit more about that tonight, of connecting air quality, air pollution, and cancer issues that we have in our region. I just want to thank the Cancer and Environment Network of Southwestern Pennsylvania. We participate in this network, and there are some common things that we do, which is use a systems approach to addressing issues. And we also believe in deep collaboration, sharing, and complementing each other's work and opportunity. So really want to lift that up and thank the network for inviting me tonight. And this is the launch event when the Cancer and Environment Network was launched in January of 2019. And it's really great to see the network coming together and having an impact in the community. So the main thing I want to talk about this evening is that we still have a serious air quality problem in southwestern Pennsylvania, and that adding to our airshed burden with additional pollution only makes things worse. If every year the Lung Association comes out with a report that rates air quality throughout the United States, and every year we in Allegheny County unfortunately get straight Fs. We get Fs for particle pollution at the annual average. We get Fs for the daily standard of particles, and we get Fs for our ozone emissions. And that's a long-standing trend. And Beaver County, where we're seeing a lot of development work for petrochemicals, they right now, their particle pollution passes the test of the Lung Association, but gets a D for ozone, and hazardous pollutants and volatile organic compounds will only make that D worse. If you look at the Pittsburgh region over the past few years, about a half to 2/3 of the time our air is rated not good according to the EPA's air quality index, meaning it's not green air. Now you can see that there was an improvement between 2019 and 2020 of a drop of about 50 days where our air has gotten a little better. But it took a pandemic for that to happen, with people stopping driving, industries being shut down, restaurants not emitting any pollution, and so on. And one would think that during a pandemic, when so much was shut down in 2020, that our air would have been good just about all the time. But even with those shutdowns, it was still not good at least half the time. These series of charts show every monitor in the United States and compares it with the annual average standard for the US EPA's particle emissions, PM 2.5 emissions, averaged out over a 3-year period. And this starts in the year 2000 and is comparing it to the 2012 standard of 12 micrograms per cubic meter. And you can see at the beginning of this century that most of the country was not in compliance with that standard. But as we march forward in time, so now we're up through 2006, and now we're up through 2009, you see the distribution of monitors starting to come in compliance. By the time the 2012 standard was enacted, most of the country was already achieving that standard or on the way to achieving it. But the Pittsburgh area, as you can see, is not there. Now, if we keep going forward up through 2015, most of the country now meets it, but Pittsburgh is alone. And now by the 2018 values, we're the lone red dot in the entire eastern part of the United States, and it's just a few parts in California that did not meet that standard. Those standards were passed in 2012, but it's based on public health data that reaches back probably 10 years prior to that. And so the standard itself has evolved over time, or the public health information has evolved over time that shows us that even that standard is not really health protective. And yet we didn't meet it as late as 2019. We did finally meet the standard in 2020, but that was during the pandemic when so much of our economy was shut down. So if this were a race, Pittsburgh is coming in last place in that race. And unfortunately, we're not positioned well to do well as those standards are going to be improved going forward. This is a chart and distribution of monitors throughout Allegheny County that, based off of data going up through 2018, that showed that air in the Mon Valley, specifically close to the Clairton Coke Works, was worse than 97% of the entire country where there are monitors. And other parts of the Mon Valley, such as Braddock and Wilkinsburg, had air worse than about 94% of the entire country, and the entire region not scoring well. I wanted to put this chart in there because this is the trends that existed prior to the pandemic. The pandemic has kind of disrupted this. We want to pay attention to what happened during the pandemic, but not forget that how late we are in the game of meeting these standards. This shows the air quality index ratings of red, orange, yellow, and green for the past 3 years. So you can see there is a shift in improvement in the year 2020 during the pandemic shutdown. However, you still see a fair number of orange and yellow days even during the pandemic when so much of the economy was shut down. And of course, this is our region's biggest air quality problem. Particles, PM 2.5, 2.5 microns in diameter. This is an electron microscope image of it. About 30 of these particles will fit across the width of a human hair. And it's dangerous because your body has trouble defending against this entering in your bloodstream when you breathe them in. And then these particles can accumulate in body tissue, and that is the connection with cancer, from particles. The carcinogenic compounds that attach themselves to these particles when combustion happens, such as volatile organic compounds, they make their way into the bloodstream and start to accumulate and concentrate. And that is why we are having this talk tonight about cancer and the connection of cancer and air quality. This is a breathe meter. This is something we have on our website where we have it so that you can compare the air in Pittsburgh with other cities around the country. This shows the updated data for 2020, where our ranking of all monitored sites in the country puts us at about the 24th percentile. Now, in the year 2019, we were at the 11th percentile, and so we saw about a 12 or 13% improvement in air ranking. However, it's important to understand what else is going on when you're comparing cities. So even though this statistic looks good, what has happened is we had some massive wildfires on the West Coast in California, in Washington State, Montana, Idaho. A lot of those places, their rankings got much, much worse. And so the very worst performing areas in the country in 2020 are dominated by places where there are wildfires. At the same time, the entire northeastern quarter of the U.S. scored much better, and Pittsburgh fit in with that trend. So the trend here is not really anything that we have done here locally to improve our air. It's that we are following along with the fact that power plants and factories and driving were all reduced in the year 2020. In fact, we would want to see an even bigger jump than this, but we celebrate where there are improvements, but it's not nearly what it should be or could be. And the danger is that we're going to go back to where we were before when we look at 2021 data. If you want to look at the monitors that we have, just to see where they all fit, there are 8 monitors that monitor PM 2.5 throughout Allegheny County. And the distribution of these monitors, this is based off of 2020 data. It's actually the 3-year average of 2018 to 2020, which is the method that's used to determine the performance. We have 1 monitor that's still in the worst 10% of places in the country, 3 more in the worst 20%, 2 more in the worst 40%, 1 in the worst 50%, and our best monitor is in the worst 60%. And there's only 1 monitor of these 8 that would meet the World Health Organization standards for particulate matter emissions. The rest of them do not pass that test. And then there's a daily standard, and so if you look at the daily average of emissions, we have 1 of these monitors that doesn't meet the World Health Organization standards, being in the worst 20%. Ozone, our region walks the line between our air being legal or in violation of the Clean Air Act. We have 3 ozone monitors, and the average of them walks the line between being in attainment and non-attainment. 1 of these monitors was in the worst 30%, and 2 were in the worst 40%. And then sulfur dioxide emissions. So this is something that happens when you combust coal in steel-making processes, in coke-making processes, and in power plants. And we have 4 of these monitors in Allegheny County, and 1 of them did not meet the standard, does not pass, or our air is technically not in compliance with the Clean Air Act for sulfur dioxide. 2 of these monitors being in the worst 10% of the country, and 2 were in the worst 50%. This is a chart that basically says that there's no lower bound of protection from reducing particle pollution. If there is particle pollution that is being emitted and in the air, it's doing health harm in the community. And all the studies show that if you even get down below 6 micrograms per cubic meter, there are still negative public health consequences of early deaths, cardiovascular disease, and yes, increases in cancer. And in fact, Allegheny County is in the worst 4% of counties nationwide for exposure to hazardous air pollutants and diesel particulates. We're also in the worst percent of country nationally for cancer risk from industrial point sources, such as manufacturing facilities. And 90% of the point source cancer risk in Allegheny County is attributable to coke oven emissions, with about 90% of that from one facility, which is the Clairton Coke Works facility in the Mon Valley. Vehicle emissions are also problematic in Allegheny County, and we're among the worst 7% of counties nationally. And then these are the risks to people in Allegheny County. About 1.2 million people are put at risk from the air quality that I've just described. And it also highlights vulnerable populations that are especially sensitive and have increased risks of more severe health outcomes when air pollution is getting worse or is not being improved in our region. And, you know, cancer risks generally from environmental sources can be from air pollution, from radon, from pesticides, from eating red and processed meats. There's also exposures in the home. Tonight, I'm really only focusing on air pollution, mostly on air pollution that's external to the home. And like I've said before, this exposure comes from people living in proximity to highways, coal mines, fracking wells, coke ovens, steel mills, and other factories. And like I said, our region really is not in good shape. We're in among the worst 1% of counties nationwide from cancer risk from industrial point sources. A lot of this is due to the legacy industry that we have, but we still have a significant amount of this type of industry in Allegheny County, and it keeps having its impact in terms of health of people in our county. And then cancer rates in southwestern Pennsylvania are up to 50% higher than the rest of the United States. Now, this is a chart that basically makes the point that cancer emerges when there are certain pieces that have to be present to allow the disease to manifest itself. And if one of those pieces isn't there, the chance for cancer to develop is much reduced. So these can be genetic factors, but one key piece of this are environmental sources and drivers of cancer, and so air pollution is one of those things. So this is why focusing on reducing air pollution is a very good strategy for reducing the bad stats that I showed you of high cancer risk and higher rates of cancer than other parts of the country. And then this chart is just showing that environmental sources that are driving cancer are on the rise compared to other types of cancer from other sources. And so focusing on environmental sources is an important piece of reducing cancer risk. Now I want to show a couple of images to bring this home. I've showed a lot of statistics and a lot of annual average and daily average, but our region still experiences some very severe events that increase pollution exposure at acute levels over certain periods of time. And I want to call everyone's attention to an event that happened on Christmas Eve of 2018 at about 3 o'clock in the morning. And I'm going to show a very quick video. I'm going to switch my screen to that other slide. So this is a video of one of our cameras. The Breathe Project has high-res cameras pointed at high-polluting facilities that run 24 hours a day, 7 days a week. And this is what our camera captured at about 3:30 a.m. on Christmas Eve. And this is the Clairton Coke Works. And what it is showing is that there was an explosion at this plant, and where that red ball of fire is, that building is about the length of a football field. And what you're seeing happening is the entire pollution control system of the Clairton Coke Works being destroyed. And what happens then is you can't just turn off coke ovens with a key. Things keep going. And so there was pollution being emitted of untreated coking gas. Now, one would have thought that the region's health department would have called people's attention to this right away, but about 2 weeks expired until they actually brought it to anyone's attention. And when it was brought to everyone's attention, it was like it was being minimized as being a concern. And what they were doing with that coking gas is piping it up to a bluff above the Monongahela River to these flares. So to give you an idea of scale, these flares are about 5 railroad cars long, and they flared that coking gas for 100 days. They did not reduce production at all, and no regulators required them to do so. And we calculated they released the equivalent of about 11 years worth of what would be regular pollution, which is already heavy from this facility. They released 11 years worth of pollution in 100 days. And what started happening was physicians that we work with in our Breathe Project network started finding that children who were being treated for asthma, all of their asthma was being out of control and required additional medication and mitigation. And this was what started the alarm bells, and the community responded by trying to demand that Coke Works would be shut down because they were experiencing these very severe levels of sulfur dioxide emissions and benzene and other chemicals. And in fact, no action was being taken, and so part of the Breathe Project's work is to organize community voices and hold a press conference to demand that something would be done about it. What happened was a state hearing was convened in Clairton. So this is an image of that state hearing. About 12 or so state lawmakers convened this hearing, and people gave testimony about what was happening. Now, what you also see in this image are a large number of people in orange suits. So U.S. Steel paid their employees to come and occupy this space so that people from the community would not have a place to sit or stand or speak out at this hearing. Now, the problem isn't just in the Mon Valley for severe episodes like that. This is a documented case that occurred in 2021, back in April, at a facility called Metallico that exists on Neville Island. And we have camera footage of this from our partner organization that participates in the Breathe Project called Allegheny County Clean Air Now. And I'm going to show you some video footage from what they captured. So this is about 5 o'clock in the afternoon on April 21st of this year. And this facility recycles automobiles and puts them in shredders. And they have piles of material that's made out of tires, plastic parts from engines, car seats. And this caught on fire and burned for about 7 hours. They couldn't put it out. I'm just going to accelerate the images. And so this camera is in someone's backyard in Emsworth, and we have monitors that showed particle levels exceeding 900 micrograms per cubic meter, where the daily standard average has got to be less than 35. High levels of benzene and other hazardous air pollutants being emitted at the time. And so thank goodness we have these cameras to be able to see when these events happen. You can see the fire department showing up and trying to put it out. They didn't put it out until after 11 o'clock that night. Now, the problem is that people have been complaining about this facility for several years. The ACAN folks have documented over 300 complaints of these types of fire events, only they're smaller in scale, but odors, noises, explosions happening all the time, and it's very disruptive for the community. And that means they're exposed to these spikes of air pollution just because of where they live. So from a data perspective and from a life experience perspective, it's clear we still have a serious air quality problem in southwestern Pennsylvania. And now I just want to shift a little bit of the conversation to what's happening when we start adding in a new heavy industry based off of petrochemicals and fracking. This is a study that was done by Carnegie Mellon, published in November of 2019, that documented the impact of the shale industry during the boom period from 2004 to 2016. And what these authors calculated is that there were somewhere between 1,200 and 4,600 additional premature deaths that occurred over this period of time because of the air pollution from the shale gas industry in southwestern Pennsylvania. And they calculated the financial damages from loss of life, reduced work hours, and so on to be about a $23 billion hit to the economy of the region. And if you factor in the climate impacts, the damages go up to $34 billion. So that is the difference between the economic benefits that's added to the economy from this industry and the damages. It's a net negative of $34 billion. So our region is subsidizing something that we know is not healthy, it's doing us harm, and it actually is impacting us negatively economically. And that study had no factoring in of the Shell plant that's being built out in Beaver County in Monaca. The Shell plant is under construction, and it will only add to the burden of pollution. This is the permitted emissions from that Shell plant that shows the addition of 522 additional tons of VOCs being added to the airshed, which, by the way, will take that Beaver County airshed to pollution levels that they haven't seen since the early 1990s, before much of the industry had shut down, heavy industry had shut down because it was old and outdated. So we're going backwards by adding this into our airshed. And just because of the COP26 climate summit that's happening, I want to call attention to the CO2 emitted from this plant. It will be 2.2 million tons of CO2 per year, and that's the equivalent of adding about 430,000 automobiles worth of carbon emissions per year. And if you calculate the social cost of that carbon using the EPA's discount rate model, just the carbon pollution from the Shell plant will cost our region's economy $2.83 billion over the life of that plant. Then there are the emissions from compressor stations, where there are venting that happens when those pipelines are cleaned out and pigging operations are underway, and just in the normal operation of diesel generators. There are emissions from fractionator plants that distill the natural gas that comes up out of fracking wells. And there's air pollution from the distribution of the chemicals on rail. There's a plan to increase rail traffic right through the heart of the city of Pittsburgh, a near quadrupling the number of trains running through the heart of the city that will bring additional cancer risk from diesel emissions, in addition to potential explosions from the transport of these products right through our population center. So what I want to say is we've been down this road before and should know better. That I grew up at a time in the Mon Valley where heavy industry still existed, but it fell apart when I was a teenager, and I witnessed the displacement of tens of thousands of people in the community. And I also watched over the last 40 years how much of a struggle it's been to clean up after an industry that is a high volume, low margin commodity industry subjected to huge fluctuations in the market that leaves a toxic legacy and increases emissions that harms the health of people that work in the community and live in the community. So why we would do this again is a question that I think our economic development people have not answered adequately, and that we need to hold them accountable to answering. So what can you do about it? Well, we need you to advocate for clean air and clean water. You can make changes around your home related to products, and I think those will be other talks that you'll see as part of the series. You can talk with your healthcare professional about cancer risk in the region and air pollution, and you can talk with family and friends about the situation that we're facing. We have tools that can help you with this advocacy. So if you go to our Breathe Project webpage, we can connect you with citizen science tools that are free. These are apps that allow you to register and document when you smell bad smells through the Create Lab Smell Pittsburgh app. We have cameras that are pointed at polluting facilities that allow you to observe when you might smell bad air. You might be able to detect a few minutes earlier or an hour earlier that there were problems at one of the plants that emit huge amounts of pollution, and you can capture that imagery and share it on social media to call people's attention to it. You can use the EPA's Air Now site to check the air quality index and plan your day so that you're not going out during days when air quality is poor. You can look at an independent network of distributed monitors called Purple Air Monitors, also to check air quality, to make sure that the EPA monitors are actually calibrated and doing their job. And then you can also look at Plume PGH to see how air pollution plumes that originate at polluting facilities make their way into the population center of Pittsburgh. You can send in air complaints. You can speak up at meetings. You can have conversations with local officials. You can write op-ed pieces. And we have tools on our website to help you with all of these things. So you can go to this site and take a look at those tools. You can advocate for environmental justice. So cancer risks from hazardous air pollutants and diesel particulate matter were 26% greater among people living in environmental justice communities versus non-environmental justice communities. And a principal driver of the cancer risk in environmental justice communities are these coke oven emissions, as well as hazardous air pollutions from mobile sources such as benzene, butadiene, and naphthalene, all associated with heavy industry and also petrochemicals. Another thing you can do is sign on to the Cancer and Environment Network's declaration. This is a policy platform document that was launched in the middle of the summer of this year, and people can sign on to this and join the many voices and organizations in advocating for addressing the cancer risks that are happening. If you go there, you can see suggestions for how everyone can get involved, and if you're a different type. And there's also information for different types of organizations for particular actions that they can take. So these are some examples of what people can be doing no matter who you are and no matter where you work or what you do in southwestern Pennsylvania. So in demanding alternatives to carcinogens by getting businesses and schools and other organizations to buy safer materials is one thing that we can all ask for. If you're a local community leader or you have an interaction with them, then you can get people to speak up about this issue and communicate about it, and also promote investment in healthier jobs and provide opportunities for people to get engaged.
Matt, I see a question in the chat.
Oh, okay. Oh, actually, I see two of them there now.
There you go.
Okay, I've got three of them. Okay, so I can pause there. So is anyone conducting a prospective study of the Claret and Neville Island residents? So the short answer to that is no. We have called for that, and people that we work with have said that the emergency response that was done for Clairton and Neville Island has been totally inadequate. That what we see happening is our health department basically deferring to emergency response groups, saying they're the ones that are responsible for telling people when these emergencies happen, and then they don't speak up. There's no canvassing of population that was impacted. You know, in other parts of the country, a very motivated health department would get everyone's name, get them registered, do a baseline assessment, and follow them through time to see if any health impacts emerge in the population of people who've been impacted by that. Now, what I will say is Debbie Gentile has written some papers by looking at the changes in emergency room visits prior to the Clairton Coke Works fire and explosion and during that time period, and she did see a significant increase in people going to the emergency room with some of the diagnoses related to respiratory disease, cardiac events, and so on. And so she just published that paper earlier this year. The second question is, how do you respond when people say it's not as bad as it used to be? So I happened to grow up in Pittsburgh. I grew up in Forest Hills, but my family all was from Braddock and worked in steel mills. So I have always been treated to this, you know, narrative of, well, you should have seen what it was like when I was growing up type of thing, and it's not as bad as that. Well, the answer is the air has gotten better compared to where we were 50 years ago. And what that basically is saying, though, is the Clean Air Act works. The Clean Air Act does its job in reducing pollution over time. However, this gets back to those slides that I showed earlier. If we were running a race, we would be in last place. Nobody tends to celebrate when you finish last in a race and you're positioned to start the next race at the back of the pack where everyone else has already been ready to go going forward. And as a result, we have all of these impacts on people's health that we've talked about. So let's see, another question that I see here is, do the masks we wear for COVID decrease particle inhalation? So I don't think that they are designed to filter PM 2.5. I have seen some, in fact, I have owned some cloth masks that have a filter that you can put in there that will filter out PM 2.5. I imagine that the masks help some, but unless you have the special filter, it may not help as much. Let's see, any video of the Neville chemical event on September 2nd? So Cliff, that is a great question. So Neville chemical, what happened there was many people started registering by way of Smell Pittsburgh, an awful chemical smell that happened on September 2nd. And it was emanating from somewhere on Neville Island. And, you know, people start getting headaches and complaining about this. And eventually, nobody really knew it was happening. So unfortunately, because Neville Chemical has not been one of those facilities that we have focused on very much in the past, we don't have any video of what happened there. And that actually, it really highlighted the importance of having that video, because without having that video, we can't identify exactly what happened at that facility. Like, we can't see exactly where the release came from. We can't look at what the color of whatever sort of explosion or fire or whatever looks like. You know, anything that would be able to be used to diagnose exactly what happened there, we can't do that. All we have done is relied upon the health department to disclose what they found when they talked to the company, and that information that they provided is still very general in their finding that they described. So unfortunately, we don't have the same evidence. We also don't have monitors nearby that can be tuned to the different types of pollutants like different VOCs, so we don't know exactly what happened there. And it really highlights when you do have the right equipment and to be able to diagnose what's going on, it makes a world of difference. Okay, so Molly is asking about a good news story of choosing safer options and so on. So those sorts of things are happening throughout the world. There are a number of companies that have targeted what it is that they're manufacturing, and they use positive lists of chemicals that are screened to not be carcinogenic, and they use those as the beginning building blocks of creating products. And those green products make a world of difference in the interiors of buildings where people live. Having those sorts of products in people's homes and office spaces makes a world of difference. And so we do see a shift happening to producing those sorts of materials and products in our economy. It just takes a long time to get them done and get them out there. Ned asked, is there a safe level of PM 2.5 exposure? And the short answer to that is all of the evidence of studies of PM 2.5 do not show a lower bound that is where you can say it's safe to breathe PM 2.5. That any place where there is observed concentrations of PM 2.5, I think the studies go down to 6 or 4 micrograms per cubic meter, still document harms. The harms are reduced than what they are at higher concentrations, but there's no safe level of exposure to that. And then Cliff is asking about the impact of inversions on Pittsburgh air quality. So we happen to have frequent inversions, particularly beginning around this time of year. It's in October, November, December, and air inversions are where the upper atmosphere acts as a blanket because instead of it getting colder with altitude, the atmosphere is warmer with altitude, and that tends to happen in the river valleys throughout our region. And that acts as a blanket and traps pollution like a lid. And so it increases concentrations of pollutants, particularly in overnight hours. These inversions tend to set up around 10, 11 o'clock at night, and they'll last all through the mornings if it's particularly strong up until about 11 o'clock in the morning the next day. So any pollution that's emitted during that time gets trapped in place, and that is the reason why a lot of the smell events that happen in Pittsburgh, in the region, and why people wake up and experience bad air quality when they go out in the morning with their coffee or on their way to work, or if they're walking their dog or just stepping outside. And so we've advocated for the health department to institute episodic pollution regs that require companies to curtail their emissions when an inversion event is predicted and air pollution concentration levels are predicted to increase. Those were just passed in this early fall, and they, as far as we know, they haven't been fully implemented yet, so that's something that we're checking on. Okay, so if you go to the declaration site, you can find all of these suggestions of what people can do. And I just want to thank everyone for attending tonight, asking questions, caring about this issue. I'm happy to follow up with you all and appreciate the opportunity to participate in the Cancer and Environment Network as a speaker, and look forward to supporting the network going forward. And I'm happy to answer any additional questions if there's time.
Any questions, anybody else? Well, thank you, Matt. Do you have our screen for our upcoming? Yes. Okay. So just a reminder that we have December 2nd, Consumer Products and Cleaning, and January 6th, Nate Burden and Jackie Nixon are going to talk about radon. We're going to continue to explore other topics and have these the first Thursday of every month. So we hope to see you at the next one. So any other questions before we close?
Yes, there is one more. Do you see it in chat?
I think I missed it. I do not. Do you see it, Kim?
The last one that I have is from Cliff.
Yes.
Do you know why our health department did not adequately and appropriately respond to the events at Clareton Works in Neville Island?
I don't know the answer to that. What that whole experience for me was particularly unnerving because as air advocates, we were having regular meetings with the health department director at the time. And we had a face-to-face meeting for an hour with the health department director and all the lead staff on January 2nd, 2019, which would have been almost 10 days after that explosion happened. And it wasn't brought up to our attention at all. That we talked about other things and not that incident. And then it wasn't really until they announced it the following week at the Board of Health meeting that this happened. And that was also when Debbie Gentile, who runs our asthma clinic, had started observing uncontrolled asthma in patients that she had under control as late as December of 2018. And then we started piecing it all together. We don't know why the health department didn't take stronger action. We don't know why the health department didn't notify everyone. We don't know why the health department didn't ask U.S. Steel to idle their coke ovens so that they didn't continue to emit large quantities of pollution. So I don't have a good answer for you for that. What I do know is that with matters related to enforcement, that there appears to be a strong influence of politics in how such things are handled in our region. And the ultimate responsibility for what the health department does, because it's an extension of the executive branch of county government, is the county executive. And so I think that is a really good question for the administration, and no one really has answered that question adequately.
Matt, I do see another one. Will wearing N95 masks reduce exposure to PM 2.5?
My understanding is that N95 masks do help with that. I don't know if they are quite as effective as if you have a PM 2.5 filter, but my understanding is N95 masks do help with that.
Anyone else? Okay, Matt. Well, thank you very much for your time tonight, and thank you everybody for participating, and we hope to see you on December 2nd.
Thank you very much for inviting me, and it's good seeing everyone here, and thank you for your questions.